Your dentist has probably advised you that you need a tooth or teeth removed, or you've asked for teeth to be removed. This presentation demonstrates why some teeth need to be removed and some don't, discusses the extraction procedure, what to expect during the procedure, and the healing period. Modern restorative dentistry can save teeth remarkably well. As you observe this patient, you see severe tooth decay. He wanted his teeth removed. After educating him about the possibility of successfully restoring his teeth, he agreed to the restorations. These are his teeth with relatively inexpensive plastic veneers on them, like false fingernails, at 2 years of service. And these are the restored teeth at 8 years of service. On the contrary, often tooth decay has destroyed the teeth to the point that it would be very expensive and foolish to restore them. The patient you are observing has had a significant amount of tooth decay, and the disease and microorganisms in the decayed teeth are negatively influencing his overall health. Removal of these teeth and placing dentures was the correct decision. Discuss the condition of your teeth with your dentist and make sure that your decision to remove or keep them is correct. There are a few very important reasons for tooth removal. Your dentist will inform you of the reason you need teeth extracted. Among the reasons are non-restorable tooth decay. The affected tooth was removed. A metallic dental implant was placed in the site where the tooth was removed, and a ceramic crown was placed on the implant. How does that look? Here you see excessive tooth wear, which can necessitate tooth removal, and it is often quite expensive to restore. Bone and gum disease, called periodontitis, can cause the need for tooth removal. You may be a teenager who has 4 wisdom teeth in place, or fewer. Sometimes there are not 4. Often those teeth become infected, where they get partially out, can't get all the way out, and they get microorganisms and debris around them, and they cause very significant challenges, even life-threatening challenges. And again, many times they'll tip over sideways and start to go into the tooth next to the wisdom tooth and cause decay on that tooth. So many times they have to be removed as well. Some of you are looking at orthodontics, and you have a jaw that does not have enough space for all of your teeth. In other words, you have bigger teeth than your jaw. How do you overcome that? A dentist would then take out premolars, usually, not always. They're right in this area of your mouth, and that provides more space for the teeth that are large to be moved into. So there are a lot of reasons for tooth removal. We'd like to keep teeth, however. Talk to your dentist about whether your teeth or tooth needs to be removed. Although modern dentistry can provide beautiful and functional tooth restorations and replacements, some of the treatment does not allow chewing and aesthetics to be as acceptable as with natural teeth. With a few exceptions, when advisable, and you can afford the cost of tooth restoration, that alternative is almost always the correct choice when compared with tooth extraction. Some people think tooth extraction solves the problems. It's the beginning of your problem. The jaw shrinks about 1/64 of an inch per year. So let's say 1 inch, and that's basically a lifetime. You have almost no bone left. Here's about what you have normally. We see jaws that are down at 1/4 to 1/2 inch where the bone has shrunken. When a tooth is removed, there's some observable shrinkage of the bone, which leaves the bone and gum tissue reduced in quantity. The patient had a front tooth removed, and it's obvious to note the shrinkage. The defect caused by this tooth removal is more than normal, but it clearly shows the nature of the bone shrinkage. In some areas, that's not a problem. In other areas where you're observing it, it can be a very significant problem to try to restore that back to a normal appearance and function. Such shrinkage can be reduced or nearly eliminated by bone grafting. Ask your dentist about this procedure. This tooth, isolated with a blue piece of thin rubber, appears to be destroyed. However, by removal of the decay and disinfecting the remaining tooth structure, the tooth was restored to function and acceptable aesthetics at a very minimal cost. These teeth were broken, decayed, and not pleasant appearing. Restoring them with crowns produced a very acceptable result, you'd have to admit. You may think these teeth look hopeless, but look at how they appear with crowns on them. Whenever possible, retention of teeth is the most acceptable choice. Your dentist will advise you if retention of your teeth would be best. There are times when it's better to remove teeth, such as wisdom teeth, or such as times when the teeth are in abnormal positions. So talk to your dentist about it. Find out. Will tooth removal cause you to have a significant health problem immediately after the teeth are removed? Careful tooth removal does not cause a significant health challenge. A single tooth exposed into the mouth can usually be removed relatively easily. Occasionally there are a few challenges, but a tooth resting under the jaw, such as a wisdom tooth, can be more of a challenge because you have to find access to that by making a little cut in the gum and spreading the gum apart, finding that tooth. Sometime removal of a little bit of the bone tissue is necessary, and then the tooth is removed. What is the tooth removal procedure? Usually, in fact most of the time, you'll receive a local anesthetic in just the area of the tooth removal. Let's say it's a front tooth. There would just be anesthetic in that little area, which eliminates any discomfort during the extraction. Most people have no discomfort during the extraction, and some have minor or even moderate discomfort after the extraction. Your dentist will advise you. More difficult tooth removal situations, such as third molars. Let's say you had 4 third molars out, or wisdom teeth. That can sometimes require you to be sedated or even to receive a general anesthetic. Your dentist will advise you the best way to eliminate any significant discomfort during tooth removal. It can be done. If infection was present in the area of the tooth removal, your dentist may prescribe an antibiotic to remove the risk of the infection becoming more severe. Follow your dentist's directions for the antibiotic. He or she may or may not prescribe an antibiotic for the situation. If infection is present, they probably will. Otherwise, they may not, because organisms are getting sensitive to the antibiotics, and therefore we're trying to avoid overuse of antibiotics. Sutures may be placed to hold the tissues together while they heal. You will be advised as to whether the sutures dissolve by themselves or that you must return to have them removed. You'll be provided with a prescription for medication to reduce any discomfort after you go home. If the procedure needs a precaution to avoid swelling, you may be advised to place cold on the extraction. Let's say it was right here. You may have to put ice packs or some kind of cold substance on that area to keep the blood from coming in actively. But after the site has had a brief time to heal, you may be advised to place heat on the same area to stimulate the blood to come in and accelerate healing. The site will usually heal very adequately within several days. If the tooth or teeth that were extracted are in an area that is aesthetically impaired or functionally impaired, such as in the front of the mouth or back where you chew, after the extraction site is healed, you can have various procedures accomplished to restore the area to optimum aesthetics and function. That would not be the case in situations where the teeth had no function, such as the wisdom teeth removal. Among the restorative procedures are dental implants with crowns on them, fixed bridges attached to remaining teeth, or removable partial or complete dentures. This patient has had 2 dental implants placed in the areas of the missing teeth and crowns placed on the implants for an excellent restoration. What have we just said? You may have to have teeth extracted, or you may want to have teeth extracted. I would strongly encourage you not to get them extracted unless they need to be. Your dentist will tell you. The advantage of keeping them in, they're your teeth. You can chew on them. They'll be there for who knows how many years. As soon as teeth are taken out, the bone shrinks, which we've discussed in detail with you. Some teeth have to come out because there's infection, like third molars that have all kinds of microorganisms growing around them. Your dentist will advise you whether or not they have to come out, and the advantages of taking them out if they have to come out, because you can have some very serious infections caused by leaving teeth that are infected in place. The disadvantages of removing teeth: bone shrinkage is the primary one, and therefore to build you back to aesthetic and to functional capability requires either grafting or some type of denture-like thing to allow you to have adequate aesthetics and function again. The costs of removing teeth, if they are mandatory, such as wisdom teeth, there will be a significant charge by the dentist to take the teeth out. The situation I'd like to explain to you, though, is many people feel because they're going to have all their teeth extracted that somehow that satisfies all the subsequent problems. Very wrong. Every few years, that denture has to be remade as the bone shrinks. And each time you go through another procedure, another development of a denture, a cost, and more bone shrinkage, so you have almost no bone. Leave them in if you can. The risks of any tooth removal are usually minor. There are some complications which your dentist will certainly explain to you in the treatment plan. On the other hand, the risks are very, very minimal. What happens if nothing is done? Well, the worst thing that can happen is you get a serious infection. You go to the hospital, and you could have something very unfortunate happen to you if the tooth is infected. On the other hand, taking out third molars that are not diseased, they come out usually relatively easily, and healing occurs quite rapidly, and you're better off than you would be leaving in infected teeth or teeth that are in the wrong position in that third molar area. Don't worry about the tooth extraction procedure or the ability of your dentist to restore your mouth back to normality. Your dentist will tell you what can be done and what should be done. Listen and ask some questions. The dental, surgical, and restorative techniques of today are highly advanced, so we'll provide you with comfortable and predictable procedures both for the tooth removal and for any restorative dentistry that is necessary after the teeth are removed.